we're all going to make mistakes. And so having some outlet for being able to talk in healthy ways, of course, um, whatever that may be, that kind of thing for sure. It's going to be helpful. So to the point, by the way, that you want to say that the mindfulness is the cure-all for all this, because talk therapy, just talking with friends and family.
Welcome to the First Responder Families podcast, sponsored by Shatterproof at FHE Health, a nationally recognized behavioral health provider. I am your host, Ivana Bada, a director of family services at FHE Health and a family, couples, and trauma therapist. Join me for meaningful conversations and talks that support wellness and mental health of first responders and their families. Hello, dear listeners. We are here with December show, and I would like to introduce you to Gus Castellanos. And Gus is South Florida most experienced MBSR teacher. And MBSR stands for Mindfulness-Based Stress Reduction. He's a retired neurologist and sleep specialist. He's an MBSR teacher trained by University of Massachusetts. He's a mindfulness research consultant with FIU School of Public Health and long-term mindfulness and Vipassana practitioner. Welcome, Gus.
Thank you, Ron. It's good to be here with you. Thank you.
Yeah, yeah. When I saw your face first time in several years, I was touched by seeing you because you were my first mindfulness teacher, and your program really shifted my life, which I didn't know at the time, but it shifted my life towards mindful and conscious awareness of my thoughts, body, sensations, my emotions. And so there was my life, before mindfulness and then after mindfulness. And I wanted listeners to hear your story, which is an extraordinary story, from addiction, to recovery, from medicine to mindfulness teaching and coaching. And I'm curious how you, after so many years of practicing and teaching, how do you define mindfulness?
Well, yeah, thanks for asking, because that's a question that is always hard to put into words. And I changed the definition, by the way, according to who I think who the audience is. Let's put it
Oh,
that way. But I did want to ask you a question because it kind of partially is for the answer. So if you don't mind answering briefly, when you said that your mind, the mindfulness got you to be more aware of your thoughts, emotions, sensations, and all of that, that it made a big impact in that, what did that do for your whole life, though?
mm, thank you for that question. Um, the answer that comes to me is that I was able to witness my experience from that place of, present moment. So even thought about the past, it didn't hijack me or didn't have such a power to hijack me into the past. And today I name it also as the capacity to have agency for my own life through mindfulness. Yeah.
Yeah, thanks for answering that, Dave, because that's part of the issue I have with the definition. Because it's very simple to say something like, well, mindfulness is just about paying attention and being aware. But the question is, why would you want to do that? Particularly because we'll say, pay attention to what's happening now. Like you said, your own thoughts. And it's just, my thoughts are terrible. I'm trying to run away from them. I'm trying to suppress them.
Uh-huh.
And so that would be the way I would kind of frame it. It is about paying attention to what's happening in the present moment, particularly within you, the thoughts, emotions, how your body feels, but also around you, paying attention to your environment and the people and all that. But you're doing that. That's being done for the reason to, like you said, it's a stepping back from what it's actually happening so you can view it, if you will, and
Mhm.
if necessary, reframe your thoughts. If the thoughts are telling you something that's not true, for instance, it's an old pattern, oh, this is no good, or this, we can reframe the thoughts. And then, like you said, the main thing is you get to choose how to respond.
Mm. Wow.
So,
Yeah. And how did you get introduced to mindfulness many years ago before it even was possible to find on Google search?
yeah, trust me, I remember those days. So it was in 1998, and since you alluded a little bit to the addiction thing, it was actually because I was having trouble with substance use, and it's my I have no problem sharing my story, but
Hmm.
I was helping myself to the samples of pharmaceuticals I was getting in the office, and as
Hmm.
a neurologist and sleep specialist, I really got all the goodies for an addict. I mean, you name it, and I got it, including opiates, which were being sampled at that point, late 90s. So I was having some trouble, and I didn't think I needed help, and my wife was like, "Yes, you need help," and I was, that whole denial thing,
Yeah.
and thinking I knew better and I knew how to handle it, and I didn't. So coincidentally, this mindfulness-based stress reduction (MBSR) program, it comes from the University of Massachusetts Medical School,
Hmm.
ends up at Jupiter Medical Center.
Mm.
And my friend was the guy who brought it in, an internist friend of mine. He said, "Hey, listen, you should send your patients to this program.
Hmm.
Insomnia, it's good for pain, it's good for chronic neurologic diseases, blah blah blah. There's research on it." And so I kind of said, "Okay, well," and then he said to me, "But you're not looking so good these days. Maybe you should take the class yourself." And he really didn't know what was going on, but he could tell that something was up. So I did participate. That was the first time I got exposed to mindfulness, 1998.
Yeah. Yeah. How did that influence you or
Well,
your life?
for sure, on two levels. On the professional level, let me go there first. Once I went to the program, because I considered myself not a woo doctor, what's that meditation stuff? That's not. But there was so much research on mindfulness back and even in '98. There's a ton more now, of course.
Hmm.
But I was then convinced that it could help a lot of the patients that I had limited options for. So I would send them to the classes starting because they kept running the classes after those 8-week classes.
Hmm.
And I was getting feedback from the patients. It wasn't like a panacea that cured everything, but they were feeding back that it was helpful. On a personal level, I could see that it helped, but I wasn't quite ready to give up. I was kind of trying to control my habits and blah, blah, blah. And one of my habits, by the way, is workaholism. So, I buried myself on work and whatever.
Hmm.
Things got a little out of hand at work and things got worse and my addiction got ramped up a lot. And then I had to eventually take the course again a second time. And that's when it clicked.
Ah.
That's when something said, I need to do something. And it took, and, I can keep going if you want with what happened next, but I
Mm.
stop and see if you have something to say.
Yeah. So you were in the midst of your addiction, but at the same time, you are trying to control some ways. It would be positive, learning how to meditate, how to be more mindful in life. And what happened next?
Yeah, so I finally had, like you said, that awareness of something was going on, and it's at a simple level. It sort of, I guess, would say stopping the denial that I could handle the problem. I had to say I can't do this, and I don't know who can or what. I
Mhm.
don't know. It was almost a surrendering effect, and gradually over the next few months, I decided to do different little things, which ended up me trying to detox myself because I was by then on heavy duty opiates.
Mhm.
Um, Really got into the opioid issue before the opioid crisis, but nevertheless, it hit me hard, and I ended up trying to detox myself, which ended up in an overdose. So I
Mhm.
ended up overdosing, and my wife found me, and they called the paramedics, the whole bit. I ended up at Jupiter Medical Center, where I was a senior neurologist and the head of the sleep center and all that stuff.
Mhm. Mhm.
And when I came out of the overdose, I sort of said, whatever you guys want me to do. I know the gig is up. Everybody now knows everything here because, people
Mhm.
will talk. And so I went to treatment and I've been clean and sober ever since, 21 and a half years ago. So,
Mm. Wow. Yeah, congrats. Yeah, I think this would be a um, great share to hear for some of our listeners who also struggle with addiction or substance abuse. Yeah. Mm.
Yeah, yeah, and not to say that the road hasn't been smooth, as you know, there's a whole bunch of things that then started catching up, but it's
Mhm.
still a better life off of the drugs, than it would have been if I would have had to go back for something. And I'm not trying to say if you do relapse, if you're listening to this and you're having an issue, if you do relapse, please get back in. It's
Mhm.
don't let the shame keep you out there. So, but
Mhm.
yeah,
Yeah. How
leaving the
was
town.
the mindfulness practice help in the recovery? How do you see it from your own experience?
Yeah, that's kind of an evolving question because when I first got into recovery, I was still practicing medicine and I had no concept of ever going to be teaching or even exploring what this meant. But since I got into 12-step groups and there's a little bit about meditation in those groups too. So,
Mhm.
but I was fascinated by then on how the working of the mind and how it impacts with the brain and not only for addiction, just for in general what's going on there. So I was meditating a lot
Mhm.
when I first got in there. Plus, I had a whole bunch more free time, and I wasn't under the influence of drugs all the time.
Mhm.
So I was able to sit down and literally, like you said, it's actually studying my own mind.
Mhm.
And I found it more interesting as coming as a neurologist, trying to put things together. But I was exploring so many different meditations. Mostly, a lot of them were my basic practice was going to be a mindfulness practice, the body scan, but I was exploring other meditations. And so that alone, just that, it's sort of not taking the place of the drugs, but that was something I was doing in the time where instead of hanging around, getting high, and, being passed out or whatever,
Mhm.
I was making use of the time. So it was filling in without me actually with an intention. I wasn't sitting there going, "Oh, one day I'll be a master of meditation. I'm going to get enlightened. I'm going to be teaching or anything like that." I was just doing it for my own information. So
Mhm. Yeah. Yeah. And I think that's the um mm, I would say sweetness of mindfulness, that you are just not having any particular agenda for yourself. Even your experiences with body scan can be different, pleasant, unpleasant on any given day, right?
yeah, and so if you want to bring that up for sure, because I don't think I was intentionally doing it for those things. But what would
Mhm.
happen, of course, if I'm doing a body scan and I'm uncomfortable, I could then start seeing, hey, if I react to this uncomfortableness by judging and complaining and this and that, I feel miserable. But if there's this unpleasantness, this little pain or an itch that's too strong, and I kind of just get curious about it and explore it, I don't feel so miserable. So
Mm.
that started, without me sitting there going, "Oh, this is the answer," and blah blah blah. I think it's just by direct experience. You start learning. Oh, do these things like that, and I feel this way. I do this things like that, and I feel that way. Yuck. So let me try this way, and
Mhm.
that's how it sort of kind of grows on me anyway. That going forward. So and helpful for recovery, for instance, it could be with a craving. Walking down the street and something triggers me, and I start having a craving and before I got into mindfulness, I'm sure would have been like, well, no, my God, no, I can't have craving. I'm no good. I must be failing. Some negative self-talk, or oh,
Mhm.
forget it. This craving's gonna last forever. I got to go use right now, and and this that with mindfulness is, well, let me just watch the craving. Number one, it's gonna pass sooner or later. It's gonna go away. Number two, I can tolerate this.
Mhm.
And watch it come and go. Watch how it makes me feel, and leave it alone. I don't feel so bad. So those are the kind of things that started helping on a practical basis. So
Mm. I can envision that, right? Like you have the same experience, like a craving, and you can ride that wave with mindfulness, or with that other part of the brain, which will take you just into memories, euphoric recall, and who knows what.
yeah,
Yeah.
absolutely.
Mm.
Absolutely. And the mindfulness, like you said, just watching all of that play out and not, trying to stay not involved, if you will.
Mhm.
That's where you get really, when you get practice this enough, this is when it starts happening. So
Mm. Yeah. Gus, you mentioned something that caught my attention. Like, another habit of yours was workaholism. And you didn't mention pressure, but this is what we see in our first responder culture that we work with, when they come to treatment, whether for trauma, substance abuse, or both, or mental health issues, they put extreme pressure on themselves, as human beings, as first responders, as providers at home. And also, they have worked like crazy hours and shifts, and it is really hard for them to see themselves just as human beings, that they need support of others themselves.
Yeah, yeah. First responders are usually the last responders for their own health, aren't they? Yep.
Mm.
So,
Hmm.
but yeah, but I think we share that in common, that sense of, I don't know if you want to call it perfectionism or whatever, but that sense of having to get things right. You're dealing sometimes, especially them, with life and death situations
Hmm.
that you don't want to mess up. And of course, a lot of the activity I'm sure they go through has a high adrenaline charge.
Hmm.
So
Hmm.
kick and all of that. Whereas for me, it was more concerning. I had more of the perfectionism, and if I messed up, if I did something wrong, then I'd work harder. I'd have to go do more research. I have to go do this. The shame and guilt of I don't want to be found out. And of course, when I start mixing in with some drugs and alcohol, then it becomes that much more shame and guilt that needs to be treated. And the only way to treat it is to either dive into work or dive into chemicals. And so I can imagine that they have a similar kind of situation.
Hmm.
Uh, we're all going to make mistakes. And so having some outlet for being able to talk and talk in healthy ways, of course, um, whatever that may be, that kind of thing for sure. It's going to be helpful. So to the point, by the way, that you want to say that the mindfulness is the cure-all for it, all this, because talk therapy, just talking with friends and family, is
Hmm.
something very helpful. So
Yeah, yeah. Mm. And I recall one of your newsletters when you mentioned, and it wasn't so long time ago, that you actually went to the doctor to find out that you have heart condition that it could lead to terminal or to death or some crisis. And it caught my attention because I know that you have been practicing teaching mindfulness. Were you more attuned to physical sensations in order to go to the doctor and find out, before crisis?
uh, good question, because that was my thing. I was asking the doctors for a scan. It's called the CAT calcium score CAT scan of the heart. I didn't have any major risk factors except for a slightly elevated a bad cholesterol. My LDL always ran right at the top, and the normal was less than 100. Mine was running between 95 and 110 for 10 years. And I never had any symptoms. I was active, I'm Mr. Stress Reduction for whatever that's
Mhm.
worth. I slept well, we eat well. So I
Mhm.
didn't think I really had any problems. So I kept asking in my annual physicals, and yeah, and the doctor, no, we don't know. We don't really know about that test, but you don't really have any symptoms. I go, but it's a simple test. Let me just get it. And they didn't do it, and they do it. And then, it just got finally, I don't know what happened, but I started having heart palpitations,
Mhm. Mhm.
but they were considered benign, but they had nothing to do with what they found. So I wanted to put that. It's just that I happened to have that. So when you say, I was listening to my body, maybe my body was trying to give me the signal even stronger. It says, hey, there's something here. Go talk to your cardiologist.
Oh.
So I went to my primary and they said, oh, yeah, maybe you should see the cardiologist. So I called a friend of mine and he's the one that finally said, you want the test? Go ahead. I'll order the test. He didn't think anything of it.
Uh-huh.
And then I got the emergency call when he got the results. Hey, you've got triple vessel. Your three main coronary arteries are
Wow.
95% blocked.
Uh-huh.
And he goes, you got to come to the hospital right away. And I go, wait a minute. It was a Thursday. I go, well, I got a class tomorrow and this weekend I'm doing this. And he goes, no, no, no. I'm talking now. I'm talking now. And so I had to go and I had emergency open heart surgery,
Mm-hmm. Mm.
but never had any damage. So it wasn't like I was getting the usual signals,
Mm.
which is good because um they like you say there must have been some
Mm.
sign because I kept coming up with the idea, and I'm not a cardiologist. I wasn't like I said just checking it out. What am I doing? It's just a test that's not even covered by insurance, so it's coming out of pocket. Not that it's expensive, but there must have been something happening.
Mm.
So
Yeah, yeah. And as I'm listening to you, I think, guys, and also for listeners, isn't that life-changing skill when you have growing capacity of awareness of your body signals? Because first responders, for example, and not only them, their spouses, their family members, they often put their needs last. And I, from my mindfulness experience, being aware of the present moment, I get aware of what I need, even if I want to make other people's needs first. I also have this information that I need rest or that I'm stressed and I need some kind of reset before I come home to small children, for example, right? Like I credit that to mindfulness, that before I react and not that I don't react at times, but I'm also able to apologize now and tell guys
right.
it's not you, so I think mindfulness really helps us to translate the body signal
Yeah,
into.
I agree 100%. That's where I try to go with this. It's called interoception, which is for mostly the autonomic nervous system, which I'm hoping most first responders know about, sending signals to the brain, like for instance, the vagus nerve sends a
Uh-huh.
lot of signals to the brain from the gut, from the chest, from the heart especially, and learning how to interpret that because the signals are considered vague compared to, let's say, when you get pinched in a skin where you can kind of localize it and almost guess what's doing it. When you got something like that going internally, it's harder to kind of, and that's for a lot of reasons. But anyway, with mindfulness, you're able to more interpret the signals, and that's the key because a lot of people have this so-called intuition and gut feeling, and say, "Oh, I can feel something in my gut," but then they use their regular everyday mind to interpret. And
Mhm.
if you're in a bad mood, you haven't slept, you haven't eaten, that same signal may be coming out. You may interpret it as something terrible when it
Yeah.
was telling you something not so terrible.
Mhm.
Um, for instance, butterflies in the stomach. Sometimes it's because you're nervous and anxious. Sometimes it's because you're excited and happy.
Mhm.
So the more in tune you can get to the body, that the body, like we say, the body knows, the mind thinks, and opinions. So they're sticking with the body and also knowing where your state of mind is. It's another mindfulness practice, so that you know when you're how you might your perception is going to be affected of how you're feeling, so
Yeah.
that you interpret it is important. So
Mhm. Yeah. Yeah. Yeah, that resonates very much. Like we shared to each other that we were sick last week, right? And I was noticing like very negative thoughts, but I was sick and I was coming from that state of, mind and body. And I didn't have as optimistic and positive thoughts as I typically have.
there you go. You can ask my wife how I was treating her last week, and I've learned enough not to stick my foot in my mouth, but at least I wasn't being friendly.
Yeah.
It was even more like that. So,
Hmm.
but can I make a quick comment about the what you were saying about taking care of our needs when we're taking care of others?
Please.
Yeah, I'm actually in part because I'm doing a caregiver program for a local nonprofit that has to do with people with chronic neurologic diseases.
Mhm.
And one of the things I've always thought about was this bit about, if what they say to caregivers, it's like when you're in the airplane and the oxygen mask drops, you should always put it on first. You should always take care of yourself first. But I'm kind of more of the opinion of the mindfulness helps you to know when you should take care of yourself and when you can take care of others in a healthy way. So that's not such an easy answer to always say take care of yourself first, because it's almost implying almost a selfishness. Let me go take care of myself. Oh, he needs some help over there. No, I need to take care of myself and this and that. Especially if you're a first responder, you're going to be taking care of those people in front of you first.
Mhm.
Almost 90%, 99% of the time, I'm imagining that it's going to be hard to say, hey, I can't do this right now. But mindfulness can help you know when to push that boundary, when it goes back and forth. Now, on a personal level, for sure, that boundary is going to fluctuate a lot more than on a professional level, but very useful to know this is one where I set this boundary, and then tomorrow maybe that boundary moves for either direction, as opposed to saying it's always like this or always like that.
I love that. So it is like the nervous system kind of fluctuates, between activation and also maybe deactivation and more peace, but also with self-care in such professions like first responder, and also for other situations like when you are a parent of small children, right? Like when do you push that boundary and how to listen to that field of boundary? Yeah, definitely. What did you learn from working with caregivers, who have to take care of people in need? How does that boundary and that oxygen mask, how does that mm, work for them?
Well, when they first hear me say it these days, they're a little bit because if I always ask the question, "Oh, you know that when the thing comes down, what are you supposed to do?"
Mhm.
Oh, I put it on me first. I know I'm supposed to, but I never do. They get questions like that, and I go, "Well, maybe it's because sometimes you're not supposed to be the first one."
Mhm.
But I know this because when I practiced medicine, I took care of chronic neurologic patients, and it was always at the beginning and when I was very young and inexperienced, you got to take care of the patient no matter what, he's suffering and all that. Then I started seeing how burnt out, especially the ones that lasted a long time, how much burnt out. And it was almost like, I can't help your husband with Alzheimer's, but I can try and help you. You're burning out. You're not
Mhm.
going to be. So then I switched all the way to let me support the caregivers.
Mhm.
And so all that kind of got mixed up for a while. And then when I start teaching this, I kind of kept that in mind that it just is not, there's no hard and fast rule. Every situation is different. Everybody's relationship is different, and the relationship and the diseases change. So to
Mhm.
give hard and fast rules,
Mhm.
don't know. But where mindfulness can be helpful is how am I right now? Can I give more, or am I completely depleted and giving more will just mess everything
Yeah.
up?
Yeah.
That would be the way to put it.
Yeah. And it gave me more clarity, because as a helper or being in helping profession, most of the time I can give. It is those moments where there is that burnout moment when I don't have capacity to give. And that's where I want to be really conscious and attuned to. Because
Exactly.
yeah, because that's where at least from my experience, where the disease, where I got either sick, or wanted to change profession. One of these two. Yeah. Mm-hmm.
There you go. My story as well on the personal side, practicing medicine. So,
Mm-hmm. Yeah. And on personal level, I know your spouse must have been impacted by your teaching of mindfulness. And do you practice together? And how does that look like?
yeah, I would say she impacted me more than I impacted her because she was trying to get me. What she started doing when I was having all the problems and telling me to go to, I thought I should get help and all that. She started doing yoga. And
Hmm.
then she started trying to get me to go to yoga, and I thought that was ridiculous. But that's when I opened up to, well, mindfulness. It's associated with some research. It's coming to the hospital. Maybe I'll do that. So she's the one that prompted me to do that. And then when things got this way and that, and started going, and I went on my razor wire retreat, she said, you should learn how to teach mindfulness. You should teach meditation since you're in there and you have the time. So she was the one kind of pushing me. And then when I come out and I start to teach it, yeah, she attended a lot of the classes and all of that. Then she went on though, she started going on the hard, I shouldn't say the hard, the extensive silent retreats before I did.
Mm-hmm.
The 10-day silence and retreats. And now she does 30 days of
Mm-hmm.
silence a year.
Mm-hmm.
So she's got, she's ramped way up. So she's more my teacher than I am her teacher. And we don't meditate exactly together. Like we don't get up and sit next to each other or anything like that, but because we have slightly different schedules, but we do meditate daily. So it impacts, and then we talk about the meditations and listen to podcasts about meditation and blah blah blah. So
Very cool. Very cool. Yeah, that's something. You may have different schedules, you may have different even hobbies, but in some ways, this is a bridge that connects you, that you can speak about your internal experiences.
yeah, and I'll say this because we hear this on both sides. It's
Mm-hmm.
okay if one person does it even a lot and the other person doesn't have any interest in it in a relationship. They can still get along,
Mm-hmm.
um, because when practiced, what do you want to call it, correctly? I don't know the word correctly, ethically, whatever.
Mm-hmm.
The mindfulness can be useful for that setting as well.
Mm-hmm.
But yeah, it's much more powerful, I think, when the two of us are doing the same thing. There's a lot more commonality, and the longevity of our relationship, I'm sure, is a testament to that. So
Mm-hmm. Yeah, yeah. Less reacting and more responses from the present moment, from the adult self. Yeah.
yeah, she says I'm a little less assholey every day. So I hope I
Yeah.
can say that, right? I can say that word.
Yeah, you can, yeah.
Okay.
Um, ah, yeah. I'm just taking a moment. I'm also thinking about experience that I have when I teach mindfulness, and perhaps before every clinical group I lead, there is a coming, presencing and arriving to the moment. And I get a couple of different responses from participants. Some of them can empty out their mind and they experience almost like a flow, like there wasn't any thought. And of course, they experience it as very pleasant experience even after like 5 minutes of breathing and being present. And some share that they were completely stuck, like neck up, just had space and lots of thoughts. How do you explain it?
Yeah, that's always a great point. The same thing, analogy of the body. The body was agitated, the body was relaxed, that kind of thing. And so getting back to introducing what is mindfulness, it's just about the awareness of what's happening. So when I point out to them the mind was full of stuff and you didn't like it and all that, how do you know that? And then eventually they keep saying things. They go, well, you know that because you were aware of that. And that's good mindfulness. So because you were aware of that and they were happened to be aware of that, what they were going through, everybody's doing good mindfulness here. That would be the springboard into the conversations because again, it's not just the awareness like we started at the beginning. It's what happens with that awareness. How do you react to it? How is your mind telling you things this way or that way, or what are you doing? Reacting, responding, that whole bit. So cultivating that moment to moment awareness with less and less judgment, less and less reactivity is really the has to be the foundation of all of this.
Mm-hmm. Right, right. Less and less reactivity, even to the unpleasant experience. Mm.
Especially to them, yeah. As hard as that is. Yeah.
What would you suggest to a first responder who is coming from difficult call, whether it's a law enforcement or firefighter or someone on 911 dispatcher, EMT, and they are returning home to their families? Would you have any, like a good practice as a suggestion?
I don't have specific. I've gotten to the point where I've done this so much, and there are so many good things out there, like this type of breathing,
Mm,
or grounding exercises, or doing this or that. That is so hard to give a list of things, but knowing that that's the way you're feeling. and having some experience by usually by direct experience have what you can go wrong if you react in a certain way. That's usually the key. It has to start. You have to just remember, it's sort of like they say in recovery, play the tape out. If you go in there like this with
Mhm.
and do that, so all of that, just being aware of that can be quite helpful. Now, the easiest thing to do for sure are going to be something like a breathing exercise where you slow down the breathing or prolong the exhalation because that'll calm the nervous system for sure. And not only does it help you calm, but that will also help you think more clearly so
Yeah.
that you can make wiser choices, whatever it is that you decide to do. And whatever you decide to do in that setting, if you do it with awareness, it will always come out better than if you do it mindlessly.
Mm-hmm. Mm-hmm.
So being aware that even if you are going to have a shot of something, I mean, I hate to say it this way, but you shouldn't be drinking. But if you do decide to have a shot, if you're saying, I know I am doing this, I know it's not the best thing in the world, but it's better for me to do this than to walk in feeling this way and that. And then you got to live with the consequences of what happens.
Mm-hmm.
So
Yeah. Yeah. Mhm. It's a for me, mindfulness is like a muscle that once you discover and you use, things that the whole life as it unfolds can be a really full experience, you know. Mm.
yeah, and it's like you say, like a practice effect, the word neuroplasticity, it just means the brain
Mhm.
is changing. So the more you do this, the more we bring awareness into the moment. And
Mhm.
that's another thing, by the way. Bringing awareness into the moment doesn't have to be done by a formal sitting practice. You certainly don't need to go on 30-day silent retreats to cultivate this to benefit. Yeah, you can do many moments, many times
Mhm.
throughout the day,
Yeah.
just brief moments, just pausing. So even that pause on the way home, just pausing in and checking in, the mindful check-in. What am I thinking? What are my thoughts about? Why, without trying to judge or figure out or analyze, just notice how is my body feeling, really going there. What am I
Mhm.
feeling in the body? And that can kind of diffuse out all of that stuff that's going on. So
It's a big shift when mindfulness is present, even to the stressful and also even to the behaviors that may not be so helpful. But with that mindfulness, there is more awareness of that's not helpful. Yeah.
yeah, so that's again gaining the information, like you said before, seeing clearly. Okay, let me just be
Clearly.
clear. Let me step back, not judge or criticize or do anything. Just look at what is happening.
Mhm.
That clear information, you're getting good information rather than information tainted by my anger and my upset or my tiredness or fatigue getting in the way. So
Yeah. Yeah. And by the way, on the different note, how is mindfulness practice and living enable to and enjoy holidays as they are coming in 2025?
yeah, and the holidays have been a shifting thing because now I have grandkids. So it was more like free floating. We'd see some kids, our families are scattered all over, mostly Florida, but we
Mhm.
could only do so much, so we weren't pushing it. And now with the grandkids, it's that much more little added excitement because they're very young. So it's just more like to sit back and enjoy these things
Mhm.
rather than try to handle the stress because as you know, I live in Jupiter near the water, and life is pretty straightforward here. It's not really high stress traffic or anything like that. So, um, but I can feel the effects of not only the people I'm working with when they come in and they're all stressed out, the holiday shopping and all of this, but of course the community getting a little more activity and all that. And so it's just a matter of being aware that's happening
Mhm.
and protecting yourself from that,
Yeah.
staying off of a lot of social media and the news that's not necessary right now, and not over shopping or overeating. So
Yeah. Yeah. And again, it's just with that awareness, that
yeah,
is the leader and coach internally, being more and more aware. Yeah. Yeah, I really appreciate you for coming on and speak about mindfulness from professional but also personal experience. And I really trust that it will spark some curiosity in our audience, and it certainly encouraged me to continue this practice. And I want to thank you for coming on and sharing just so honestly, and just bringing your spirit and your humanity into this conversation. Thank you, Gus.
Yeah, no, thank you, Ivana. It's always a pleasure. It's always good to see you. It's been such a long time, but yeah, I hope it's helpful for somebody. But I really, really appreciate being here with you. So
Yeah, and I will make sure in our notes there is your website, and also the Mindful Leader. It's a great platform for a very small amount of money where people can meditate with teachers and within the group every single day. So I'm looking for,
yeah, by the way, I'm there Thursday mornings at 7 a.m. So I'm
yeah,
on that. So yeah,
good to know. Thank you so much,
yeah,
Gus.
no,
Happy
thank you.
holidays.
So, yeah, same to you. Be good.
Thank you for tuning in. The First Responder Families podcast is sponsored by Shatterproof at FHE Health, a specialized treatment program for first responders with mental health and/or substance use issues. For more information about our show and our services, check out fhehealth.com. The podcast website also has a place where you can share your ideas or questions for future shows. If you are struggling, we want to help. Feel free to call us at 844-714-3403 or visit fhehealth.com. We look forward to having you join us for our podcast next month. Until then, take care.